So, chapter 40, Devita, CA colon. What is the role of lifestyle as a risk factor for colon cancer? Physical inactivity has been associated with colorectal cancer risk, and for colon more than rectal cancer. A sedentary lifestyle may account for an increased colorectal cancer risk. Although the mechanism is unclear, data suggests that physical activity after the diagnosis of stage 1 to 3 colon cancer may reduce the risk of colon related and overall mortality, and that the amount of aerobic exercises correlates with the reduced risk of recurrence following resection of stage 3 colon cancer. More recently, positive association has been established between increased amount of recreational physical activity before and after colorectal cancer diagnosis and lower mortality. Most studies of alcohol have demonstrated at most a minimal positive effect. Association are strongest between alcohol consumption in men and risk of rectal cancer. Perhaps interference with folate metabolism through acetaldehyde is responsible. Prolonged cigarette smoking is associated with risk of colorectal cancer. Cigarette smoking for 20 pack years was associated with a large adenoma risk and more than 35 pack years with cancer risk. To examine the impact of smoking cessation on the attention of this risk, Gong et al. Conducted a pooled analysis of 8 studies, including 6,796 colorectal cancer cases and 7,770 controls. Authors found that former smokers also remained at risk for up to 25 years after quitting, and this varied substantially by cancer subsite, with the risk declining immediately for proximal cancer, colon and rectal cases, but not until 20 years after smoking cessation for distal colon. Now, diabetes and colon cancer. Type 2 diabetes has previously been implicated in development of colorectal cancer, but it has been difficult to separate this association from other confounding lifestyle factors such as smoking and obesity. Two recent meta-analyses provide further evidence that this condition is in fact significant independent risk factor. Yuhara et al. Identified 14 studies, most of which controlled for smoking, obesity, physical exercise, and demonstrated that diabetes was associated with increased risk of both colon and rectal cancer. A second report analyzed 24 studies, found a similar association with higher risk for those patients on insulin therapy. Then drugs like NSAIDs. So non-steroidal anti-inflammatory drugs. Population-based studies strongly support inverse association between use of aspirin and other non-steroidal anti-inflammatory drugs and the incidence of both colorectal cancer and adenomas. As a result, NSAIDs and selective cyclooxygenase 2 COX-2 inhibitors have been investigated intensively in hereditary and sporadic colorectal cancer. Long-term results are now available from CAPP2 study, and the first double-blind randomized control trial of aspirin chemoprevention with cancer as the primary endpoint. And in this study, 861 patients of Lynch syndrome were randomly assigned to aspirin or versus placebo. With a mean follow-up of 55.7 months, authors report a significantly decreased incidence of colorectal cancer in treatment group, as well as trend towards reduction in the extracolonic Lynch syndrome associated cancers. Importantly, there was no significant difference in adverse events such as gastrointestinal bleeding, ulcer, anemia during the intervention period, and this data provide strong rationale for routine use of aspirin chemoprevention in Lynch syndrome and established a foundation for further study in sporadic neoplasm. In a combined analysis of 4 large randomized trial of low-dose aspirin 75 to 300 mg per day involving 14,033 patients, aspirin intake for 5 years or more was associated with reduced 20-year incidence in mortality due to colorectal cancer. Reduction was largely confined to right-sided tumor. In addition to generalized chemoprevention, the question of aspirin and other NSAIDs in patients with diagnosis of colorectal cancer has been addressed. Liao et al. Have reported evidence that suggests that aspirin therapy after colorectal cancer diagnosis may be beneficial to those with whom have a PIK3CA mutation, but not in those with wild type PIK3CA. However, PIK3CA mutation had no impact on the influence of COX2 inhibitor rofecoxib and on cancer recurrence. Bisphosphonate, in addition to being one of the most commonly used medications for osteoporosis, bisphosphonate have been shown to have various anti-proliferative, anti-angiogenic, pro-apoptotic, anti-adhesive effect in preclinical studies. Practical impact on malignant disease, however, has been inconsistent. Singh et al. Performed a recent meta-analysis demonstrating a statistically significant 17% reduction in colorectal cancer with bisphosphonate use, and this finding was observed independently for both proximal and distal colon cancer as well as rectal cancer, highlighting another potential pathway for chemo prevention. Statins is a long-standing debate regarding the association between the statin use and cancer, with research currently underway to evaluate the specific chemopreventing properties of these agents that may include inhibiting tumor growth and angiogenesis, attenuating metastatic potential, stimulating cellular immunity, and potentiating anti-tumor effect of some cytokines. Epidemiological studies on colorectal cancer have produced very inconsistent results. Liu et al. Conducted a meta-analysis of 42 studies and found that statin use was associated with modestly reduced risk of colorectal cancer, and this effect was more pronounced for rectal cancer and in lipophilic statin uses like simvastatin and lovastatin. Due to the heterogeneity of the included studies, the authors were unable to draw any conclusion regarding dose duration and side effect, and interestingly, the risk reduction was not significant in a subgroup analysis on long-term statin users. Definite recommendations await the result of ongoing prospective prevention trials. Now, biomarkers. In an effort to improve screening protocols and advance understanding of colorectal carcinogenesis, investigators are focusing on a variety of biomarkers for increased risk as well. Toriola et al. Evaluated CRP, C-reactive protein, and serum amyloid A, the two common inflammatory markers in Women's Health Initiative observational study. And with over 900 case control pairs for each markers, author found an elevated concentration of both CRP and serum amyloid A conferred significantly increased risk for colon cancer. And this is not surprising given the role of inflammation plays in colorectal cancer carcinogenesis, as well as new promising data surrounding NSAID's chemoprevention. Leptin, a peptide hormone produced by adipocytes, is also thought to contribute to colorectal cancer carcinogenesis, and a recent prospective analysis found that soluble leptin receptor levels which may regulate leptin function was inversely associated with both colorectal and colon cancer risk. This finding was independent of leptin levels and other circulating biomarkers. She et al. Performed similar investigation of insulin-like growth factor peptide, also implicated in colorectal cancer carcinogenesis, and found that high levels of insulin-like growth factor 1 and insulin-like growth factor 2 significantly increase cancer risk. Along these lines, high circulating levels of C-reactive protein, a direct marker of hyperinsulinemia, may also be a protective factor for increased colorectal cancer risk as indicated in recent meta-analysis. HPV, the human papillomavirus, is well established as a critical pathogenic force behind cervical and anogenital cancer. Its role in colorectal cancer is less clear. An association between the two was first reported in 1990, and since then, a growing number of studies have detected the virus in colon adenocarcinoma specimens. And the first meta-analysis to address this topic, including 16 articles and 1436 patients, Damin and Ziegelman and Damin, not only reported a high prevalence of HPV In affected patients, was also found strong correlation between the HPV positivity and increased colorectal cancer risk, and this results may indicate an alternate pathway of colorectal cancer carcinogenesis that could have an implications for treatment and prevention. E. coli is another pathogen under the investigation. Despite being ubiquitously among the gut flora, studies suggest that the mucosa adherent or mucosa internationalized strains might play a role in carcinogenesis by inducing chronic inflammation and synthesizing toxin that affects cell proliferation, differentiation, and apoptosis. Bonnet et al. Found an increased prevalence of this pathogenic strains in colonic tissue from cancer patients versus control, as well as in more advanced versus early stage tumors. And the authors also confirm the carcinogenic properties of one of the cancer associated strains by demonstrating a marked increase in colonic polyps burden in mice that were inoculated with this strain compared to control. Thank you.